discharging the responsibilities of the office to which you have been nominated?
No, I do not.
Do you agree without reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of Congress if you are confirmed?
Yes, I do.
And finally, do you commit to providing a prompt response in writing to any questions addressed to you by any senator of this committee?
Yes, I do.
Thank you, Mr. Kennedy. And before you begin, if you would like to, you may introduce your wife and children.
Yes. My wife, Cheryl Hines, is here. My daughter, Kit Kennedy. My son, Bobby Kennedy. His wife, Amaryllis Fox Kennedy. And my nephew, Jackson Hines, is here too.
We welcome you all. Thank you. You may proceed with your statement.
Thank you, Mr. Chairman. Chairman Crapo, Ranking Member Wyden, and members of this distinguished committee. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponential.
I don't know, Morel, if you can hear me, but something's wrong with my
States
Clubhouse. I
has worse
can't
health than
mute
any
or
other
unmute.
developed nation. Yet we spend
restart.
more on healthcare, at least double, and in some cases triple, as other countries. Last year we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he is more than just concerned for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that. Due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options. Beneath the sea of desperation and debt, if we don't change the course and ask why are healthcare costs so high in the first place. The obvious answer is chronic disease. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I am anything or any industry. I am neither. I am pro-safety.
Please proceed, Mr. Kennedy.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our culture, of our politics, of our national security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed without a partnership, a full partnership of American farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions. Well, I'm not going to apologize for that. We have massive health problems in this country that we must face honestly. And the first thing I've done every morning for the past 20 years is to get on my knees and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. That's why I'm so grateful to President Trump for the opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. The members of this committee, to the President, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply. We will remove financial conflicts of interest from our agencies. We will create an honest, unbiased, gold standard science at HHS, accountable to the President, to Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy. Mr. Kennedy, I will begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond to them promptly. Mr. Kennedy, you have emphasized the importance of nutrition in preventing and managing chronic disease, improving health outcomes, and reducing health costs. I share your interest in the relationship between our diet and our well-being. And if confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why you are passionate about the nutrition-oriented disease prevention and what you have learned?
Yes, Mr. Chairman. I had 11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic. When my uncle was president, 2% of American kids had chronic disease. Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. It was 77% of our kids cannot qualify for military service. When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 to 1 in 1,500, depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just a economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. A federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between being and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, or a Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
Thank you. Senator Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions, I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Free podcast was a fragment of the statement. he asked me, and anybody who actually goes and looks at that podcast and will see this, he asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
He interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
Mr. Kennedy, the facts.
To the audience. Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa, in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find.
Want to pay less to get your taxes done for you? We'll beat your tax pros price from last year. Switch to a TurboTax Full Service Expert.
I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that, Senator, if you let me finish, Senator.
You have had some time.
If you let me finish, Senator. If you let me finish. There are 83 people died when the tissue samples were sent to New Zealand. Most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my
Chairman, I just
arrival.
would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say and then address those things you disagree with. I'll make sure I say for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps to keep faith with taxpayers. I expect HHS to provide timely and complete response to congressional oversight. Number 2, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even asking your support for legislation that's before the Congress. But drug pricing. Senator Durbin and I have for a while been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for rural community hospital demonstration programs. It also ignored concerns from rural pharmacies when implementing changes to Medicare Part D, and ignored rural needs when it comes to distributing physician residency slots. I expect you to prioritize rural Americans' health care needs. On agriculture, in our meeting earlier this month, we talked at length about agriculture. You prefaced the conversation by saying you will not have jurisdiction over these issues. I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, USDA and EPA. On dietary guidelines, I've sent letters to the Secretaries of Agriculture at HHS requesting that they provide information regarding conflicts of interest advisory committee to increase transparency by Congress with confidential financial disclosures from the advisory committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence. Lastly, HHS, Office of Refugee Resettlement Oversight. Last year, I expanded my investigation into HHS's Office of Refugee Resettlement. I wrote 24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children have been placed with improper vetted sponsors, placing them at risk of trafficking. The Biden administration's HHS directed these taxpayer-funded contractors and grantees to not respond to my inquiry. This is obstruction by the executive branch. I expect you to produce to me the records and data I've requested and instruct HHS contractors to fully cooperate with my investigation. I also expect HHS to not retaliate against any whistleblowers, including those who identify ORR's failures to in vetting sponsors on the company. You got 45 seconds to respond if you want to.
I agree with all of those provisions, Senator. My approach to administration HS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies, HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case. And if Congress asks me for information, you will get it immediately.
Thank you.
Thank you. Senator Cantwell is next, but until she returns, I will move on to down the list, and that would be Senator Cornyn.
Mr. Kennedy, welcome to you and your family, and congratulations. I appreciate Senator Grassley raising the issue of the Office of Refugee Resettlement within the auspices of Health and Human Services. I think this may surprise people, but that's actually the responsibility of HHS, the Office of Resettlement Relocation. Under the previous administration, as Senator Grassley alluded, there were roughly 500,000 children, unaccompanied minors, that were placed with sponsors in the interior of the United States. The previous administration took the position that it was not the federal government's responsibility once these children were placed with these sponsors. But the New York Times, in a series of investigative stories, pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school, whether they were being trafficked or abused, there was no answer. And they took the position it was not their responsibility. So I look forward to working with you to find those children and to make sure that they're not being abused. Millions of Americans are experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator, and let me just reassure you that President Trump has personally spoken to me about locating those 300,000 children who disappeared over the last 4 years.
I don't think anybody has a fully accurate number, but it's hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services and substance abuse services, this is a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. And answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment. But it's fleeting and it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
I appreciate your answer. Our time is short. Let me get to one more question that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people today, or in 2021, it's projected to have 2.5 billion people by 2050, or 25% of the global population. In 2020, PEPFAR reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 20 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries.
You mean
like
we
China.
give Pfizer
And I'd
$50
like
billion
know,
a year to vaccinate
check
people in
the goals
Africa?
of PEPFAR, and would you work with me and my colleagues to make sure that this program continues?
Jesus. But first, get yourself a McDonald's from DoorDash.
Or need.
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
Thank you. Senator Bennett. Thank you, Mr. Chairman. Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important healthcare jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world. We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world. I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. These are, and we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of Mr. Kennedy. What is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths, peddling in false statements, peddling in theories that, create doubt about whether or not things that we know are safe are unsafe. Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children
who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that.
I'll take that as a yes. I have to move on, I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want
disease
all of our
said.
colleagues to hear it, Mr. Kennedy. I wanted to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools, and for families all over this country
Fucking
that are suffering
piece of shit.
from living in the richest
This guy's a
country
real
in the world
piece of shit.
that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do to dual eligibles?
About
Dual eligibles.
Well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service, is paid for by employer taxes. Medicaid is is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans, like myself, I'm on Medicare Advantage. I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was really designed for a target population, the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed. We need to figure out other options.
Obviously, you've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it more cost efficient?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system.
So
rather than a service-based system.
On Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
Listen, I think that there are many options with telemedicine, with AI right now, and there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest providers.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee-for-service.
Traditional Medicare?
Yes.
That's their choice right now. We have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 on Medicare Advantage, roughly half and half. And I think.
Are you making the most of your health savings account? Whether you're purchasing eligible...
There's very good services, but people can't afford it. It's much more expensive. In answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so it would bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care, to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. we need to listen to what people, they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen, Senator Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign, and you put out that?
I don't think my campaign exists anymore.
Right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days? Funding and any kind of further work? NIH research?
As Chairman Crapo pointed out.
I'm not asking for, I love Mike Crapo. I'm asking you. You're up for a very, very important position.
As he pointed out, Senator, the portals that were closed were not closed as a result of the Trump
administration. Let me just tell you, I'd like you to explain, excuse me, sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Chinook Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration...
You don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to
Medicare. The freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees?
Well, President Biden this year changed 3,000 employees at HHS. 3,750 at
2,200. What departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
Let me just, I'm down to a minute 30. The chairman's been generous with colleagues on both sides and may have to go a couple minutes over. But let me just say, so let's just answer, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there are 91,000 employees.
So that, I take that as that's a simple yes, and I'm going to take that as a no.
Run that
I take that as a no.
agency.
Will you, actually, we talked about protecting Americans from cyber criminals. Something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
So I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly.
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president.
Does that mean you're not going to freeze the funding that is currently frozen?
The White House has made clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to health care that come from the federal government. They come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.
Senator Langford.
Chairman, thank you. Mr. Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and backgrounds and things. You've been able to address a lot of them today, and just different questions to be able to clear up social media rumors and the things that are out there on it. So I do appreciate that. We've talked about pharmacy benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life and when life begins on that. You've been very outspoken on that, and we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This is an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that, and he's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening, and for other areas of poverty health care because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title 10 on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural health care. How are you going to handle Title 10?
I'm going to support President Trump's policies on Title 10. I agree with President Trump that every abortion is a tragedy. I agree agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title 10. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience.
When you shop in the Jewel Osco app, you can count on us to choose fresh produce, guaranteed.
And said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is what patient would want somebody doing a surgery on them that, believes that the surgery is against their conscience being forced to perform that. I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity, and we need to respect each other when we have different opinions, and not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of it, don't even go anymore to see a physician. But they also changed an area that has been something that's been very particular. You've talked about a lot. That's transparency. They changed the position and said, don't tell us if there's a side effect in this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, will FDA move to be able to actually give transparency to the American people and to say this drug is no different than any other drug? We don't get protected just because it's political for some folks. People should know side effects on this drug, and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug, mifepristone, and every other drug. And President Trump has made it clear to me that one of the things he is not taking a position yet on mifepristone, a detailed position, but he's made it clear to me that he wants me to look at safety issues. And I'll ask NIH and FDA to do that.
Thank you.
Senator Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. 2 things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013. And frankly, you frighten people. 2, I want to air harms.
Really?
That Rhode Island
Kennedy
has
frightens people.
experienced
This fucking
from a
psychopath. All these
remorseless,
fucking senators
senseless
have got to
CMS
go.
bureaucracy.
They are beyond fucking evil.
CMS has for years
These are just the worst people in
maintained
society.
a
It's
reimbursement
unbelievable.
system that the bureaucracy could never explain,
Democrat senators,
never
I'm not
justify,
ahead.
that
This
persistently
guy's a real
pays
piece
Rhode
of
Island
work.
providers less
Oh, Rhode
than
Island. Couldn't you do
neighboring
any better than
Massachusetts
this, Rhode
and
Island?
Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra, years ago, briefly, fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record. Without objection.
Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing in a value-based plan. And I look forward to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point then we will move on to Senator Daines.
Mr. Chairman, thank you. Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, to be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state, there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. I want to talk about agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state. A lot of folks have discovered it. They watch the show Yellowstone, and people are coming and moving into our state. But it's an amazing place. But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we have a safe food supply chain in the world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers before implementing any policy that...
Any personal commitment and a long career working with farmers, I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want, under my watch, a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, to be confirmed as HHS Secretary. Even more important, President Trump had a very strong commitment to farmers. President Trump is probably historically in modern history the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me that he wants farmers involved in every policy, and that he wants me to work with Brooke Rollins at USDA to make sure that we preserve American farmers, that all of our policies support them.
Mr. Kennedy, thank you. And if confirmed, I look forward to having you and Brooke Rollins out to Montana to spend some time with
you. You have my commitment to come there anytime, particularly during ski season or hunting season.
Deal. I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission to review these deregulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, it's immoral to have a policy where patients are not allowed to report adverse events or doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee to make those policies make sense.
Thank you, Mr. Kennedy.
Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yeah. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yeah. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I ask Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American benefit.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes. So
now, a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know if the state
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. I'm not trying to be evasive.
Let me ask you
Senator, I'm
this.
just telling you I don't know the
I
answer to
appreciate that.
question.
But what authority do you have over this as the director of HHS?
What authority do I have?
To enforce the law.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that.
Well, let me tell you,
we have
you do.
a law enforcement branch at HHS.
Actually, you do. And
Want to hand off your taxes? Get more from your tax expert and spend less.
States complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And, unfortunately, Republicans in Congress to repeal the Inflation Reduction Act, which means reversing
The Inflation
all of those
Reduction
things that
Act
they
is
worked
a
on to
spending
lower
act.
prices
Thus,
for
it's not an
Americans.
inflation
So my
reduction,
question
it's
to
an
you
inflation
is,
act.
what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly as that we need lower prices as seniors in this country, and
so let me ask you. Let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma, and Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, it doesn't matter that you're before us. It could be anybody coming before us, as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues moving forward, knowing that it's going to harm Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again.
So is that the only reason why you're at HHS? Is that the only reason why then you're at the HHS, to address that one issue?
President Trump has asked me, because I'm in a unique position, to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso. Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting healthcare in my home state of Wyoming as well as the nation. I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America. Financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in areas, locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states. Either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end average of rural hospitals, and he's asked me to do that through the use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those the remote parts of Wyoming, Montana, Alaska, etc. We also have opportunities at HRSA and at the GME to finally live up to GMA's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority of mine, if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals is maternity services. So now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem as a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all.
I like it. It's mine. The prices blow my mind. I feel so rich. I feel like a billionaire. I'm shopping like a billionaire.
We need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation. But I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness?